In Malawi, it's Annie.
I'm Annie Alaniz, and what else do I say about myself? I'm a gynecologic oncologist, so I take care of women that have cancer. I do surgeries for those cancers, and I also give chemotherapy.
Annie grew up sharing one room with her 8 siblings. Statistically, she shouldn't have amounted to anything. She wasn't just poor, she was a girl. But Donna from Texas met Annie on a mission trip and offered her the chance at an education.
I was told I was insane and it was crazy. I was bringing this unknown village child into my house. And yes, it's one kid, but to one kid, that's huge. But she ended up the homecoming queen, the Miss Spirit queen, and the valedictorian of that high school.
Now every year she climbs Mount Kilimanjaro to raise funds for children who were once like her. Every year. She has also climbed to the top of her field as chief resident of her hospital in Houston. And back in Malawi, she's built 12 children's homes, a primary school for 400, a church and a clinic treating 35,000 patients a year. Annie is giving tens of thousands access to the same opportunity she was once given by Donna.
I think the story that really affected me, Mom had showed up with this child who had had diarrhea, and she had walked like 15 miles maybe to come to the clinic, and she was very dehydrated. And my dad knows this procedure where you can do, they're called interosseous needles, where you can actually put one through the bone when you can't find an IV because the child is so dehydrated. He couldn't start a central line because he didn't have any of those things, and I knew those things existed here, but they didn't exist there. So I kept throwing him ideas of things that he's like, oh, don't have anything for that. Nope, don't have anything for that. So now I was starting to see all the things he didn't have at his disposal. And then now it was becoming clear to me the gap. And I just remember feeling desperate because, you know, what else could we do? She was becoming more and more pale and less responsive, and was just sort of laying there. And I think I had exhausted everything that I could think of from the limited medical knowledge that I knew, and it became clear that we weren't gonna help this baby. And so I was there with my dad and watched her die. Her mom wailing, and she was by herself. My dad was helping her tie the baby on her back. I realized like this woman was gonna walk back home for 15 miles like with a dead baby on her back. Really was healthy 48 hours before that. I couldn't take it. I just lost it because it's just so senseless. I remember the nurse coming and saying, oh, it's okay, you don't have to cry. This happens here all the time. But I was like, why? Why does it have to be? You know, I mean, what makes that baby less important on the planet? And I think that is some of the things that drive me every day, because I don't know why being born in Malawi just stacks everything against you. That just makes you a non-entity. When you don't see yourself in the face of someone and you can't see you in their shoes, it is very difficult for people to identify themselves with that as something that could happen to them and not just look at it as an African problem. It's all of our problem.
February is known as the hunger month in Malawi. This is usually when the corn from last year has been used up, and then the corn that was planted this year, in fact, is not quite ready for harvest. As I'm standing here today speaking to you, it is not lost on me that while I'm here, there's actually a little girl in Tonje village where I grew up who's gone to bed hungry tonight. She will wake up in the morning and she has to decide if she's strong enough to run to school with an empty stomach, or if she will decide if she needs to go stand in a long line and wait for food that will be donated that she could take back to her family. Or if that doesn't work, she'll be deciding if she needs to go work for the day to get a bowl of corn flour that she can make porridge. I really feel incredibly blessed tonight because I'm standing here in front of you as this little girl who once had no pedigree. She had no standards of any kind by the world definition of what a person with a pedigree should look like. And now here I stand as a United States-trained gynecologic oncologist working for Houston Methodist Hospital, one of the largest hospital systems in this state. The girl who attended school under a tree with no access to textbooks, minimal to no options for higher education, is standing right here at Lakewood Church on this platform, truly humbled and acutely aware that God is truly in the business of using ordinary people to do the extraordinary work of his kingdom. I can tell you the imposter syndrome often brings its ugly head in my head all the time, especially when I find myself in places and platforms of people who have very deep roots. They have accolades, they have pedigrees that I could never speak of. But as I've leaned into what God has called me to do as a gynecologic oncologist here in the United States, as well as a co-founder of Pothawira in Malawi, I have realized that my humble beginning is the reason the suffering are actually drawn to me. It's also the reason why I'm naturally drawn to those who are suffering and they need help. I can connect with patients that have cancer because I have seen and I have known the fear of death. I can care for those who do not have and those who have with the same level of respect because I have lived in poverty and understand the need to feel heard and to feel seen as equally human and equally worthy to access good care. I have felt rejected and forgotten in my suffering. But God has used that rejection to in fact become what is now the elevation to his call of action to the poor and for those who are suffering. I know that there's someone in this room who has exactly the same feelings that I've had. You're wondering, how do I fit in this group? The same God who found me in Tonje village and lifted me to this very stage is the same God that has brought you here this weekend for this very moment. Take courage from Acts 4, verse 13 to 14. This is after the Holy Spirit had descended on the disciples. It says, when they saw the courage of Peter and John and realized they were unschooled, ordinary men, they were astonished and took note that these men had been with Jesus. This verse continues to encourage me that even though we may feel ordinary, unschooled, with no expertise in international domestic matters of service, God has put each one of us on this earth for a special purpose. And in fact, our identity and the pedigree that I did not think mattered is the pedigree of the creator of the universe himself. Today, I'm able to stand here to share the complexities and the multi-layers of poverty that transcends just the needs for the basics, but requires addressing all the inequality gaps that exist to bring about sustainable change. The World Bank estimated that as many as 685 million people were living in extreme poverty at the end of 2022. In order to bring about lasting change, it is really important that organizations understand the multi-layered complexity of poverty. They have to join forces and address all the social and economic layers contributing to poverty and inequality. We have to start, yes, by addressing the basics, such as food, shelter, love, and safety, but then move beyond that to create a real change. Matthew 9, verse 35 to 38, Jesus went through the towns and the villages teaching their synagogues, proclaiming the good news of the kingdom and healing every disease and sickness. When he saw the crowds, he had compassion for them because they were harassed, helpless, like sheep without a shepherd. Then he said to the disciples, the harvest is plentiful, but the workers are few. Ask the Lord of the harvest, therefore, to send out workers into the harvest field. So in the Bible, the shepherds are used as leaders of God's people. They watch for enemies might attack their sheep and they defend them. They take care of the wounded sheep and they also search and rescue those who are lost or trapped. 18% of Malawi's children aged 0 to 14 are orphans, which is one of the highest orphan rates in sub-Saharan Africa. Most of these children are forced out of school and must work to support themselves and their families. At Pothawira, our initial goal was to find and shepherd those orphaned and poverty-stricken children and the widows who also needed care. We built homes where the widows actually care for the orphaned children. It's been a very beautiful relationship to watch the bonds that our women have, because you have widows that want children to love, and we have orphans that are looking for mothers to love them. This has provided the basic needs: food, shelter, love, and safety for both the widows and the children. Meet Mary and Timothy. Mary actually became Timothy's mother at age 13 because her mother had passed away from complications of HIV. The first time the kids were discovered, Mary had actually gone to the HIV clinic where her mom used to receive medications to return the leftover medications. Timothy had malaria and severe anemia. He had to be hospitalized and given blood transfusion. Mary actually provided all the bedside care for him. There were many times where she went hungry just to allow Timothy to be able to eat. The children had nobody to take care of them. Very soon, that smile on Mary's face actually disappeared. She has a chronic disease, and she decided to stop taking her medication so that her disease would just take her out of her misery. Mary and Timothy are now living at Pothawira, where they have a home, they have food, they have love of a mama who cares for them. Now, Mary's 17 years old, attending high school and boarding school, and the biggest thing we have to worry about is she's such a girl, we got to figure out how to keep her from chasing boys. Timothy's 7 and attending primary school at Pothawira. But then after this, what happens after the basics? How do we move from creating programs that actually prevent orphans, poverty, disease, and early death, and provide sustainable and long-lasting change? Poverty is not just a lack of money. It is not having the capability to realize one's full potential as a human being. This means poverty is simply lack of opportunity. If you go to Tonje today, where I grew up, and you ask the children what they want, they're not going to ask you for toys. They're not going to ask you for clothes. They'll ask you for a chance to go to school. As Nelson Mandela put it, education is the most powerful weapon that you can use to change the world. I remember someone once asking me that if I had money to send kids to school, would I rather send 100 kids and teach them to read and write, or just a few and take them all the way to college? It took me back to the decision that Donna Ivy had to make 2 decades ago. With the money that she spent to put me through college in the United States and medical school, she could have taught thousands of children in Malawi to learn to read and write. However, Donna knew that while my ability to read and write would have been beneficial, giving me the chance to reach my full human potential and would have the longest and biggest impact. She knew that a higher education would actually get me a seat at the table where important decisions about children that grew up just like me would be made. She knew that having my education would end up putting me on this very stage tonight. Malawi's greatest asset is her people and her children. And if we're building the future for Malawi, we have to provide education for the children in the community so they can reach their God's full potential. Meet Joseph. He calls himself a sound engineer. Joseph has no access to a fancy library or books, but somehow he created a fully functional stereo speaker system using a plastic empty gallon, an old radio that he repaired, and a small solar panel. He plays very loud music at recess at school, and I'm not sure his teachers are thrilled, but I think it's pretty genius. To the right are the boys that actually wanted to play pool, but they don't have a pool table. So they picked up some sticks and mud and they created a pool table, and they've got fruits and vegetables there that they're using to play pool. How much fun is that? Within the minds of these children is the capacity of each of them to actually come up with innovative ways to solve all the problems in my country. So for this, Pothawira is providing primary school education, computer literacy for the children in the community. We're actually now building and almost close to completion of a champions club that will be empowering children with special needs. Thank you, Lakewood. We have a high school that is under construction. We have scholarship programs to send children to technical schools and university, and these are kids who would have never had access to education. There are 250 million children in the world who cannot access school. When children have no access to school, they are more vulnerable to sex traffickers, sexual abuse, poverty, and hunger. I want you to meet some of our success stories. Here's Florida. She was one of our orphaned girls, and she has completed a tailoring program, and she's now making products that she can sell to support herself. Dorothy was sent on a scholarship to a teacher's college. She's now back at Pothawira teaching our children who saw her as one of them. Now she can teach them how they can be inspired to be one of her later. Owen is treating our parasites in our animals and gardens. Emma was sent to midwifery school and is now back working at the birthing center. Annie was also sponsored through the scholarship program and has now become a registered nurse who is a charge nurse in our maternity ward. Selena, I love Selena. She went to mechanic school. She makes me especially proud because she managed to finish school in an all-boys program and is now our mechanic at Pothawira. Way to go. These children now have a sense of pride as they've realized their full potential as human beings. Our organization will only be able to see a few that we change, but the few that we have changed will affect change for millions of others in the future. Deuteronomy 28:8 says, "The Lord will send a blessing on everything you put your hands." And Galatians 6:5 says, "Each should carry his own load." The value of earning a living and teaching a man how to fish is fundamental in maintaining the dignity of people living in poverty. We teach our children community to grow food throughout the year so that there won't be a hunger in February. We have a maize meal, rice meal, we're building guest houses, and we have made sure all our programs hire staff and to run all the facilities from our community. This has really brought significant individual and community pride and a sense of accomplishment. Addressing healthcare disparity and inequality is another critical component of addressing the layers of poverty. In Malawi, life expectancy is 65. The median age is 16.8 compared to 30.3 at global level. That means 50% of Malawi's population is under 17 years of age. And in fact, 70% of Malawi's population is under 30, compared to 14.4 here in Texas. This is due to the high rates of maternal mortality, malaria, HIV, cervical cancer, respiratory infections that account for the major deaths. Close to 1 million children in Malawi are orphaned, and they're not likely to attend school and more likely to be forced into child labor. Limited access to medical care and lack of resources and skilled staffing is one of the reasons for this. Meet Naomi. Naomi's mother was pregnant with twins. She lost her husband to complications of malaria. She decided to walk 15 miles with her friends and labor onset. Unfortunately, she ended up delivering in a field of corn. She suffered postpartum hemorrhage and died before she delivered the second twin. Naomi was actually brought to the orphanage wrapped in her mother's cloth that was still dripping with blood and dirt. This happens too often in Malawi, and I find it senseless and unacceptable. On a most recent trip to Malawi, I was actually called into an operating room with a woman who had ruptured her uterus. She had actually made it to the hospital, but because there's one C-section room in a catchment of 560,000 people, her uterus ruptured while she waited. It was a miracle because we operated her in a room that had no lighting, no cautery, no blood bank, limited suture, and surgical equipment. I remember at the end of that procedure, I was with my friend, Dr. Fiona Lindo, and I was asking her, how could we be doing this again when we lived through this exact same story last year? What difference are we actually making? And in fact, on that trip, there was a 24-year-old on the same trip who died before we could even get to her. Mothers in Malawi are the ones who keep their families together. And if we're going to address the issue of orphans, we have to do better to provide health care for them. So at Pothawira, we now have an outpatient clinic that sees over 30,000 patients. We have a 24-hour clinic to make sure our children with malaria get early diagnosis. And we have a maternity ward that also is providing antenatal and postnatal visits. We have had over 400 deliveries with no maternal deaths. The most recent addition is actually ongoing construction of a surgical center, which will be available immediately for C-sections, hopefully by the end of the year. We're actually going to increase the capacity of surgery from 1 operating room in Salima to 5. We recently broke ground, October of 2023, and this is the best part of the story. Last year, I was at this conference, and I had a divine appointment with an architect. I call him my unicorn architect, Mark Garrison. Mark actually lived in Zambia, which is right next door to Malawi, and he built a surgical center for Mukinge. I had actually just received the grant for the surgical center in November. I don't know how to start an operating room. I don't even know where to start. And while I was here, I was listening to Mark talk about how he built a surgical center in Mukinge. And look at how God works. He's now our architect building the surgical center. In fact, even better, he trained Bupe, who's a Zambian guy, who's actually now the project manager in Malawi and training Malawians how to build a surgical center. That is sustainability. Nelson Mandela once said, poverty is not an accident. Like slavery and apartheid, it is a man-made and can be removed by the actions of humans. The theme of this conference speaks to the idea that each one of us plays a role in survivor-driven change when we do something for the least of these so that they can move from a place of injustice to a place of influence. The complexity of poverty has many layers and can create a sense of helplessness to solve these big issues. As I mentioned, God is in the business of ordinary people doing the extraordinary. No one is a better example of that than I am. I have no roots in the United States. I have no pedigree that opens doors automatically for me. I'm not Oprah, who can call her few of her favorite friends and raise millions of dollars for a cause. My story, however, could have ended in a village, as many stories of the children. My journey brought me so many miracles which were delivered to me by ordinary people who decided to do the extraordinary for the least of these. My childhood experience that I faced were the training ground for what God has called me to do today. In the voices of those wailing mothers that lost their babies to treatable and preventable diseases and the tragedies of young women dying in childbirth, what I heard was a call, who shall we send? Who will go? And my answer was, even without resources, here I am, send me. As you listen to all the speakers this weekend, please remember that don't be overwhelmed by how much change has to be done. You are a child of God. You are an heir to the kingdom of the creator of the universe. Whatever he asks you to do, he already has a means for you to be able to achieve it. God is in the business of using people who are the lowest of the low for his kingdom. He will use your rough edges to bring you to the places of elevation. Every experience you have had in life has been preparing you for the ministry that God has chosen for you. You may be the person who will choose to build a school in a village that never had access to a school, or the nurse or doctor who will start a training program in a country that never had access to specialized surgical care. You have everything that God needs to achieve this mission. My friend Thomas, who reads Many Hopes, said this to me once. He said that one day all of us want to be able to say that we've done something good and we have the right answer. He said that one day our grandchildren or great-grandchildren will come home from school and tell us what they learned, that there were children in Ghana many years ago that were made to work on boats as slaves, but in 2035, this was eradicated. They will say that they learned that childbirth used to be a life and death decision for women in Malawi, but that in 2035, it is safe for every woman in Malawi to have a baby. They will ask us if we had anything to do with that change. They will ask all of us if we had anything to do with that change. what would each one of us want to say we did for the least of these? My prayer is that we will all be able to say that we played a small part in empowering and helping survivors and children of those communities to get the lift that they needed so they could make the changes in those communities. And I want to thank all of you for being here, because you're here for exactly that reason.